Antara Senior Care launches its first senior care home in Bengaluru, strengthens presence in South India. Antara Senior Care, a subsidiary of a 4 billion Max Group, has proudly inaugurated its first care home in Bengaluru today. Building on its success of positively impacting the lives of over 60,000 seniors in North India, Antara Senior Care is delighted to introduce its innovative assisted living and transitions care faculties to the Garden City of Bengaluru. One moment.
Someone's house. So this is the
nation's shifting demography. It is predicted that by the middle of 2050, there will be more people over 65 than under 15. And these stats definitely make us think about the evolving needs of seniors. At Antara, we understand this need and we are endeavoring to create an integrated care ecosystem, offering a blend of lifestyle and life care services. To improve the well-being of seniors in Bengaluru, we are delighted to announce the opening of our first care home. Our goal is to establish a comprehensive ecosystem that would enable our seniors to live with respect, dignity and comfort. Thank you to join us in this inaugural event. To begin with, I would like to call on stage Mr. Rajat Mehta, MD and CEO Antara Senior Care, to share the opening address.
And a warm welcome to all of you. A special welcome to Dr. Alex Thomas, who's been a mentor and guide to many of us for many years in healthcare. So really thank you for taking the time to be here. And when he comes on stage, he will share with you he's doing some very interesting work in the elder care space. He's really a big supporter and advocate that things must change to support our elders. Delighted to be here today. This is a very important milestone in Antara's life journey. In terms of caring for seniors, creating an integrated ecosystem for seniors. I'm so glad after over a decade of existence in North India, Antara decided to foray into Southern India, which is a far larger, more mature, more accepting market in terms of senior care. We also want to work with people like Dr. Alex to advocate the right policies, for the sector, including financial instruments, specifically insurance or reverse mortgage. But that is required for seniors to be able to afford these facilities. So thank you very much once. And you are one of the important voices that will help us properly evolve the sector as we go forward. So my experience so far has been that the southern market seems to be far more mature and far more accepting of the concept of senior care. Maybe it's cultural, you can throw some light. But what do you think are the unique issues that seniors face in Bangalore, and what can the government do in terms of policy, which we can work with you and somebody else to be able to create the proper ecosystem for senior care?
Thank you, Rajat. Now, if you look at senior citizen, what are the main concerns? I think one is access to healthcare. Number two is financial stability. I think these are two very important areas that the government needs.
So I must congratulate Antara for this service to the senior community. This is a much needed service, and the people of Bangalore, the patients in Bangalore are definitely going to value this. So all the best to this venture, and want to thank Antara for adding this value add to the senior citizen community of the city. And all the best, and God bless. I'm really glad that Antara decided to foray into southern part of India, starting with Bengaluru and Chennai. It's a more mature and larger market. I'm delighted to announce the opening of the first care home today, dedicated to all elders, in Bangalore. This is meant for elders who cannot be maintained at home and have age-related issues, need help in their activities of daily life, or have gone through an intense medical episode like a transplant or a cardiac bypass or a stroke and therefore need rehabilitation for 4 to 6 weeks. It's a very home-like environment with caregivers, around the clock available, nutritionally assisted meals, activities to keep them mentally and physically active. So I'm really glad we are able to offer this, to Bangalore. Thank you very much.
Some expansion plans.
Yeah, so as I said, there are 3 verticals, businesses that Antara operates. Residences, where we have a community in Dehradun, 197 units, a community in Noida under construction, 340 units. Yesterday, Max Estates launched the first intergenerational community in Gurgaon, where there are 6 towers, 2 towers dedicated to seniors, which are being maintained and serviced, by Antara. And then looking at exploring other geographies like Bengaluru, Chennai, and Chandigarh as well. Second is care homes like this. So we already have about 168 beds or so, in the NCRs, 90 more coming up. This is the first 80 beds, in Bannerghatta. 80 more beds in Whitefield currently under fit outs will become available to the customers around January. Looking out for 200 beds more in Chennai. So by the end of this year, we'll end with about 600 beds, for memory care, stroke, care homes. Sorry?
How to contact and how to approach.
So there are several ways. We'll be obviously, being active on social media, as well. Also through, hospital networks and through doctors by word of mouth. We'll reach out to the seniors, tell them about the facility. We also offer care at home services. As I said earlier, we also have launched a chronic disease management platform for seniors called Age Easy, where there are products available curated for chronic conditions which will help them age with ease and joy.
Your good name, sir?
Rajat Mehta,
Designation.
Managing Director for Max India and for Antara Senior Care.
Thank you.